Welcome to Amplify Family Medicine, the official podcast by the Alabama Academy of Family Physicians. In each episode, we dive into the challenges, triumphs, and innovative practices that shape family medicine across our state. Whether you are a medical professional, a student with an interest in family medicine, or simply a health-conscious listener, Amplify Family Medicine promises to provide invaluable insights and inspire action. Let's amplify the impact of family physicians in Alabama together.
Well, welcome to this episode. We're so excited to have you guys join us. I am joined by, I don't know what to call them. Sometimes I call them like my older brother. Sometimes I call them like my Drizzy. Sometimes I call them, whatever they'll answer to. And they answer to pretty much anything, which is kind of scary sometimes. But I'm Brittney Anderson. I'm the current board chair of the Alabama Academy of Family Physicians. And I'm joined today by Dr. Lee Carter, Dr. Ray Stewart, and Dr. Drake Lavender. And it is wonderful, guys, to have y'all here with me. We'll answer some questions. I've got some questions that students have sent to us. We'll go through those. A couple that we threw in that may throw you guys off a little bit, but I'm here to have a good time. Y'all ready to have just a little bit of a chat this evening?
Absolutely.
Roll Tide.
Roll Tide. There you go. Let's do it then. We're talking mostly about rural practice. We're talking about rural healthcare. We all have a rural background, have all practiced in rural areas, and have a unique love for rural medicine. And we understand that so much of Alabama truly is rural. And so by doing our part, we are taking care of rural Alabama, the people of Alabama who need us most, but also doing some really cool things along the way. You guys are so fun to hang out with because y'all always have the best stories. Y'all have done so many things, and I want to get into some of those things as we talk. So we're going straight to it. Before I do that, though, y'all introduce yourselves. I know where you are, but tell everyone who you are, where you're recording from tonight. Lee, you're up first.
All right, I'm up first. Lee Carter. I'm from Tallville, Alabama. That's where I was born and raised, and I do have the privilege of practicing here now, same place, Tallville.
There you go. And I'm going to put you guys on the spot with a question. You all realize that I have no hobbies, or maybe my only true hobby is podcasting. Carter, what's your hobby?
My hobby is I also farm, and so when I get done every day, there's chores to do, and it's my form of therapy. So I also
sounds
farm
more like
on the side.
work. It sounds more like work than a hobby.
It is more work, but it's therapy for me. So a tractor puts me at ease. So it's my therapy.
There you go. We'll take it. Ray Stewart, tell us a little bit about you. Where are you now, and what's your hobby?
So I am broadcasting from my office at the University of Alabama. I'm assistant professor in the College of Community Health Sciences, and I direct the Primary Care Sports Medicine Fellowship. Was born and raised in Phoenix City, in Russell County, and I've been living in Tuscaloosa for a while. Practiced in Gordo for about, I think, 4.5 years with Dr. Lavender and Dr. Brandon. I got a lot of hobbies, and you know that. I like a good fountain pen. Like to.
He means he loves a good fountain pen.
But probably one of the things that I enjoy the most is, and I'm going to put myself out there a little bit here, is I enjoy building Legos.
There you go.
And one of the things I enjoy the most about that is I have to make so many decisions throughout any given day that I just have to be creative and kind of work through. When you build a Lego and you follow the instructions, all you got to do is put the piece where it tells you to put it, and there's no decisions to be made. So it's kind of like Lee on his tractor. That's therapeutic for me. So no decisions.
Love that. Love it. Drake, now I have a hard time calling you Drake. As a student resident, I always call you Dr. Lavender. And then when I finished my training, I called you Drizzy. In public, I call you Drizzy. People probably wonder why I call you Drizzy. I will never let it go. So tonight, I'm going to try my best to call you Drake, but I'll probably call you Drizzy. Tell us a little bit about you, where you are, and what your hobbies are.
I love Drizzy. Keep it up. So I am originally from Utah, Alabama.
Utah with an E.
EUTAW, Alabama, in Greene County. I am currently broadcasting from my office at the University of Alabama. I'm an associate professor in the Department of Family, Internal, and Rural Medicine, and I'm the director of rural programs. The thing that I do for fun is I love to travel, and I'm a foodie, but I also love to cook, and so that is probably what I do the most for for fun and relaxation. That is calming to me to cook.
There you go. All right.
Yeah.
Well,
Y'all
let's get
need to
into
get you
it.
some, hang on, Brittany. Y'all need to get y'all some Lavender's Blueberry Bliss. It's his blueberry jam that he makes. It's I've got a couple of jars. I'm not going to give up anytime soon. So
I want some.
Like,
I've got a patient who makes me strawberry fig jam. That is
that's
top
oh,
notch.
I do too. Strawberry fig. I got
Yeah.
a patient that brings that to me too.
And then I've got
Top
one who
notch.
makes me
But
homemade
I need
bread.
to try. I want to try the blueberry though.
There you
I'm
go.
Got it.
We
telling
got
you,
to
Do
get
that's,
you, do you, hold on though? Do you get the biscuit with it? Like, is there is the biscuits come with it or no?
Well, that's a special order.
No. Okay, I got you.
what you
I
call an
gotta work
upgrade.
that one out.
Yeah.
There you go. All right, guys, I've got some questions here in front of me that I'm going to ask you guys. I've got some names flagged beside them that I may single out someone to answer, but if you feel like you've got a better answer or a funnier answer than someone else gives, feel free to throw your hand up and say, "Hey, Anderson, I've got one for that too." So the first is for all of you. I would like for you to tell me a small town perk. So all of us, whether we are now, currently, or have in the past, practice medicine in rural Alabama. Tell me a small town perk about rural practice that people in outside communities just may not understand. I just gave you mine. My patients, and Lee may have given his too, but I'm sure he's got a lot more. My patients bring me all kinds of things. I get strawberry fig jam, I get homemade bread, I get preserves of all kinds, I get sweet potatoes, whatever they are growing, they bring. And I think that that is a perk of practicing medicine in rural Alabama. Lee Carter, what you got?
Those of you that know me well know that I always have on odd socks, crazy socks, if you will. And so my patients have picked up on that. And so I haven't bought a pair of socks in at least 5 years.
That's
I have
wild.
not bought a pair. They love bringing me new socks. Like, Dr. Carter, have you wore my socks? And so that's maybe one of the perks of just my particular job. The other perk that we have in Otagoville is we have a water bottling plant. And so it's pretty cool. It's one of those places to see, like a little gym in town. And they bring us water. We do some stuff for the water plant. So it's pretty cool to have on your own water bottling plant that they do from start to finish, by the way. Like, they make their own bottles, they water it, do the whole thing there in the plant. So it's pretty cool.
And it's really good water. I've got a bottle that's literally right there. It's just out of arm's reach, so I can't pull it up.
They
But
have it at Walmart and Winn-Dixie
there
in
you
your
go.
town, in
Yeah.
Alabama. They do.
Yep.
There you go. All right, Ray Stewart, tell me a perk of practicing or working, living in rural Alabama.
Well, the patients always bring you stuff. I think that's the number one thing, and you'll hear that probably as a theme with all of us. But I've still got a couple of folks that still see me here. They drive in and see me now. And I've gotten all kinds of food, items over the years, produce, that kind of thing. I mean, some of the food is good, and some of it, you have to look at it and say thank you, and it's not something I necessarily want. But Miss Connie used to be at the front desk in Gordo, and I'd always ask her, like, is this good, or should I let this one go? And she'd always give me a good guidance on that. But one of the things that I love the most is when people bring me art they do. There's a lot of talent in rural Alabama in terms of arts, both like woodworking, and then there's print press and painting and things. And I get a lot of that kind of stuff, and I love that because it really adds to kind of the stories that you can tell in your office. And one of my favorite things I got, or two of my favorite things I got, was a woodworking piece, a mosaic of an elephant with an Alabama logo on it that a patient did for me, and it's hanging right up here above me right now in the office. And then the other thing I got that's at my house is a print of a old time Alabama saying, and it was at the time, I'll be honest, I didn't know what it meant when she brought it to me, but the saying was, "Light a shuck, it's coming up a cloud." And I was like, "What is that?" And she explained it to me. But back in the old days, when the storm was coming in, they light a corn shuck, and the corn shuck would burn fast, so you had to move so you could see where you're going until the corn shuck burned out. So basically, it's like, hurry up and get out of here. We're about to get hit. And I like it because I look at it every day, and I'm like, sometimes you get in those situations, you got to light a shuck and get out of town, and get past something hard. And it's kind of been of a life lesson to me. So I've really enjoyed having that piece to talk about. And it's a real conversation starter too. So
There you go. I've never heard that. Lee Carter, have you ever heard that out in the country?
Never heard that one. Never heard that one.
There you go.
that's a first, man. I got one on you. I don't know
There
how.
You got one on me that time. I've never
Wow.
heard that.
I'm going to mark that. I'm going to mark
Yep, mark that one up.
There you go. All right, Drizzy, tell us a perk you find of living, working, being in a rural community.
Yeah, certainly the food. Yeah, I've already talked about. I guess that's going to be my theme tonight.
Yeah, there you go.
But yeah, the best caramel cake I have ever eaten was made by Miss Daisy in Gordo. We had another lady who would bring us a full lunch. Like she would put, the chicken and dumplings in the crock pot and bring them up to the office and fresh made cornbread and just feed us one day, and of course the jams and jellies and all that stuff's real close to my heart. But one of the things that I got was an invitation to a catfish fry. And I did not realize how unique and how like that was a big deal. Like I went there and, it was at an old syrup mill just off the little side road where our office was. The first day we walk up there, they're frying catfish and hush puppies and French fries and I get a plate and I sit down, I kind of look around and I am the youngest person there by 20 years, And I was telling somebody about it later at the office, and they're like, "Whoa, you got an invitation to the fish fry?" And I'm like, "Yeah." And they're like, "Nobody. That is an invitation only thing. Nobody gets an invite unless you've been here for 20 years." So I guess taking care of the right folks can sometimes get you an exclusive invitation.
I want to make a note that I was never invited to the fish fry. I don't know what I need to do. But I kind of regret that. I also regret that you didn't invite me.
There you go, right? You had a +1 and didn't.
What are you doing? Drake, you can't forget about Miss Pat, our nurse practitioner. You can't forget about her watermelon rind pickles.
Wow.
And she'd make deviled eggs with them. And that was a real perk working with her out there. And she... we need to get her to make another batch for sure, but those things are special.
Miss Pat,
pickled watermelon rinds are delicious. They are surprisingly very good with homemade vanilla bluebell ice cream. Don't ask me why I know that, but I've had some long days, guys. Trust me, that is a combo that you guys need to try.
Lee, I know you've had watermelon rind pickles.
I have. Yeah, I've also thrown more watermelons than anybody should ever throw in their lifetime.
That's not a debate at all.
Yeah, that's a different story for a different day. That don't have to do with medicine on that.
That may come up later. You never know. I've got a good list here in front of me, guys. So Lee, let's talk about having your own practice in rural Alabama. So I do, you do as well. You're out in Natalgaville and in practice. And again, the students sent some questions in, and one of the questions that they asked was, have you found that having your own practice in rural Alabama is realistic, or does it at times seem overwhelming to you? And if so, how do you navigate that? How do you manage it?
Answer that's both. Certainly sometimes it's overwhelming. Is it realistic? Absolutely. Do you have to work very hard at what you do and kind of diversify what you do? Yes. So in my case, I do some hospice work to supplement my clinic work. I also do some nursing home work to supplement my clinic work to kind of make the patient numbers work for reimbursement levels. And, does it present its challenges? Yeah. I mean, your paycheck is the last paycheck written. You're going to pay all the bills. Everybody, you want all your, injectables. You need all your stuff to go in the clinic. The power bill's got to get paid, the water bill, all those things have to get paid. All your staff wants a paycheck, and then your paycheck is the one that's due. So sometimes, you're wondering if you're getting a paycheck or not, and it's tough. COVID brought that out tremendously. People were scared to come to clinic. In the country, telehealth, it was very difficult because of the internet network in rural areas. Even my internet from home, I tested positive for COVID way early in July of 2020. I had to work from home for 2 weeks, and I actually got people to come to the office and we could FaceTime over iPads, and it worked that way. But when we try to do it from people's homes, it just wouldn't work, and not even from my home, barely it worked. So but does it have its rewards too? Absolutely. Being your own boss, setting your own times. I don't miss my little girl's volleyball games. I didn't miss my son's football games. Those things were a priority. You work your schedule around that, and sometimes it's difficult if you work for a corporation. If you work for an entity, it's harder to do those types of things. So, is it doable? Yeah. Does it have rewards? Absolutely. But at times, is it frustrating and difficult? Yes, absolutely as well. But it's absolutely realistic.
Absolutely. I agree with you 100%. I was talking with the residents up at UA recently just about, private practice, kind of the ups and downs of it, but how they end up being mostly ups for me. And it's been fun. So to the
Oh yeah,
student who
it's
asked that
crazy.
question, yeah, to the student who asked that question, if you are listening, private practice in rural Alabama is absolutely doable. It's
Absolutely
doable.
doable.
Absolutely, 100%. All right, Jersey, you're up next. And you already started talking about this. And I don't know if that caramel cake you mentioned is available to everybody, but if there are docs listening to this, or students or residents listening to this, and they want to find a hidden gem of a restaurant in rural Alabama, and they call me, they call Lee, they call Ray, well, Ray will probably have one to give them, but if they call me, I'm saying call Lavender. Lavender's got one for you. Where are you sending them?
Oh my goodness. Well, of course, I know the places that I practice better than anywhere else. I will say that the Pizza Doctor in Carrollton
Ah,
is
yes.
high quality, very good. It's one of those old school pizzerias, like you go in and you sit down and you eat it there.
Mhm,
It's not like a Domino's where you get it and take it home.
mhm.
Now you gotta use some caution because it's going to be the temperature of the surface of the sun when it arrives at your table.
100%. Been there, had that.
Uh, but it is delicious. I will say that now I don't believe it's open anymore, but there was a place in Monroeville on the town square that was called Prop and Gavel, and they made a killer hamburger. I'm not sure that place is still open though. Uh, Anybody else got anything? I mean,
Yeah.
I'm
Prop
uh,
and Gavel's good. It's been several years. I'm not sure if it's still there or
Yeah, I
not.
don't I don't know if that one's still open or not.
yeah.
Never
One
had
of
that.
my one of my favorites is not open anymore, Drake, and you know what it was. It was in Gordo. It was
Willow's
Willow's
Edge.
Edge, and I'm sad that it's not there anymore because they had the every Thursday. Drake knows this is smothered chicken, and man, that was something else. And then we had to finish clinic early, and I always was like rushing to get out of there because I needed to make sure they still had a slice of Hershey cake left over at the end. So I weigh considerably less now that I'm not in Gordo. So
There you go. That'll do it. 100%. All right. I'm going to keep there at you. So, you mentioned kind of being the current medical director for UA Athletics program. Tell us one of the most rewarding or maybe even the challenging experiences that you have working with student athletes and kind of how you balance working with athletes and seeing patients, and even a little bit more how you balance that even when you were working in rural Alabama. So dealing with, you and I have talked about kind of high school sports in rural Alabama is a whole other thing. So tell us how you kind of marry your love for sports medicine and community together.
well, I think that the same thread that kind of unifies all of the things that we do, no matter where our areas are, is the relationships that we have with people, and that includes your patients, obviously, but also the people you work with, the staff and the learners and all the folks that come through there that you get a chance to build relationships with, and that's kind of the way I handle the student athlete situation is I develop relationships with them. They're my patients. I tell them that from the first day I do their physical is I say, look, I'm your doctor. You're my patient. That's it. It's you may be an elite athlete and playing at the highest level, but you're still my patient at the end of the day. And I'm going to tell you what I think is right for you to do. And I think that there's not enough of that in our field of sports medicine. I think that people sort of forget that sometimes. I think there's still people that do it really well, but I've always prided myself on that, and I learned from some of the best how to do that. And that's kind of the most rewarding thing about it is when you have an athlete that comes back after 10 years and they want to see you again. because you took such good care of them when they were in college, and they bring their kids to you. And I would guess that all of you would say the same thing about your practices too. Balancing is hard because there's so many demands on your time. People want a piece of everything that you do, and you have to really carve out that. Lee kind of mentioned it earlier. He gets to control his schedule a lot more. I don't always get that. But I have to kind of put that limit on what I do and put boundaries into it with the folks that I work with and for. And they've been really, really good about that. And so you have to make that time and for yourself and for your family, and no job is worth, sacrificing that, no matter what it is. And so it's really hard. But I think when you have the relationships with people, they know you care about them. You can make those hard decisions. You can look them in the eye when they're on the sidelines and they're getting pressure to be put back into a game. And you can say, I got you. I got your back. I'm going to do what's right for you. And they trust you implicitly. And that's the best feeling.
Yeah. And that's tough. I was waiting for you to bring that up because in my experience, I'm sure in y'all's too, we've all been there seeing, these athletes, especially high school athletes, right? And worst case scenarios, you get a high school athlete coming back. It's playoffs time. They need to be cleared to go back for a game. And it is, no, sir, we are not clearing the day. We're just not there. And that's tough. I've been there. Have you guys, Ray, I know you've been there. Lee, have you been there with your guys? You're on the sideline for Talga Academy as well. Yeah.
Yeah, I had a patient that high-profile athlete from a little bitty school that I take care of, signed with the University of Alabama, and I wouldn't let him play. He had a knee injury that was not ready yet. Everybody wanted to see him play, and everybody wanted this and that and the other, and I was like, "It's not ready yet. You're not playing." So yeah, we've all dealt with that, and I know Ray deals with that all the time, and Drake has dealt with it at Gordo. High school football is powerful. In Gordo, where Ray and Drake were, is a powerhouse in the state of like 2A football. So, I know they dealt with that too, and you do what's best for them, and they trust you, and that's exactly what Ray said. If they trust you, they're going to look at you, and they know you're telling them the truth. You shoot them straight all the time. You don't sugarcoat anything. But there's no crying. There's no crying in football.
Right, absolutely. Or baseball, right? Not the movie. But that's the beauty of family medicine in rural Alabama, right? Is that you develop this rapport and you develop relationships with families that even if it's tough for them to hear what you've got to say, well, you take care of them since they were younger. You take care of their mama and their grandma and their aunties and their cousins, and you're there at the football games, right? So they know that you have their true best interest in heart. And I think that certainly helps to kind of tamper down a little bit of the heat that comes with having to make those big decisions. And whether that's, on the football field, whether it's, is with people being able to turn to work or school or other things they may have going on, I think folks really do understand that the relationship that they have with us and how we care about them as people, not just as whatever that profile thing is, goes a really long way. So I agree with you guys. All right, let's lighten this up a little bit. We're going around the table. Whoever wants to go first can. Tell me the most surprising or funniest encounter you have had while working in rural medicine. Now, don't give me any patient identifying information or anything like that. We're not trying to get our little show shut down, but tell me a funny story. Lee, you got to go first. Y'all get ready. Drizzy Ray, get ready.
Wait a second. If he goes first, we can't top him. So
I gotta do
it all goes
a
down in a
chance here.
All right, I got one, and I'll circle back. I got one that is not even a patient encounter. It won't even have any HIPAA whatever. I had llama in the office.
A llama
wearing a diaper, and I have photo evidence.
That's right, because you sent me a picture, and I remember
I told you, I had a llama. I had a llama in his office wearing a diaper.
You charge the copay?
No, the patient. So the patient's significant other came in and wanted to talk about this, that, and the other, and she was like, had a llama on a leash wearing a diaper in the office.
I mean, is that a service animal? Can you even ask? Like, what is?
What do you do at that point? She already had it in the office.
Hold on, stop for a second. So was the diaper just about a courtesy to your office, or because there was an issue?
No, the diaper. It was an infant llama, so it was like a baby llama, like 6 or 8 weeks old. And so she had like modified the diaper, like cut a hole for the tail, the whole 9 yards.
That's hilarious. You said it's an infant llama. I thought you were about to say it was an
Yeah,
incontinent llama.
yeah, no, I don't think it was incontinent, but she had it on a leash, and the patients loved it.
That's wild.
So they wouldn't ask
And
you to see the llama. They were just bringing the llama by for you to.
They were just
Hey.
This particular individual runs like a rescue type operation. So she's got the miniature horses and donkeys, and I think there's an ostrich involved. I'm not sure, but So exotic. There was some exotic animal involvement. And I tell you what, I tell you something else, and I'll give it up. I don't want to take it, everybody, but I have allowed one of my nurses has a Boston Terrier, and she brings it to the office, and we do a lot of pediatrics, and I know y'all did too in Gordo. It has made such a difference in giving shots to like kindergartners. Having the puppy in the office where they can hold the puppy, and if they need some blood or if they need shots, I will tell you it's been a game changer in my office having that little Boston Terrier.
Yeah, that's great. My Ivy, my Airedale Terrier, came to clinic, and kids
Right.
loved her. The older patients loved her. It was a whole thing. Literally, the whole town mourned when she died because
I
they
know
were
they
all
did.
so
I know
good
they did. As we all
seeing her
do.
in clinic. Yeah, absolutely.
That may be the world's only emotional support llama, though. I don't know if we.
Yeah, I've never had the llama before, but I 100% had and I will text you the picture in a little bit so you can see it.
Yeah, we're gonna need some proof, man. We need some proof.
I'm fixing to group chat that right now while you go.
Our group chat is wild, in case anyone is wondering what the group chat looks like. It's all over the place sometimes, guys. All right, Ray, Drake, y'all got a story for me?
Yeah, I got one.
All right, you want to go last, or you want me to go last? What do you want to do?
Go ahead. I think I got
I think you're gonna win if I know what you're gonna say. I might have an idea. So I may or may not have signed up to be part of a post-apocalyptic militia. So I'm not real sure. I had an encounter with this guy, and it was normal visit, and I was getting ready to finish up and leave, and I was just doing my usual thing, like holler if you need anything, kind of deal. And he said, "Hang on, I gotta ask you something else here." And I was thinking, like all of us are thinking, like this is about to be oh, by the way, I need something really complicated that you got to do at the last minute when you're ready to move on. And I said, okay. And I turned around, and it totally wasn't that. So he goes, "Listen, I got this place. I can't tell you where it is. It's out in the country. It's out in the woods. Listen, when it all goes down, that's where I'm going to be. And I'm only inviting a select few people to this thing."
And you're on the list?
Now, hold on. He said, "I got everything I need. I got everything I need. I got all the supplies, the food, what have you. I've been prepping for years. I got my own ammunition, got the whole thing, weapons." He said, "I don't have medical. I need a doc, and I need medicine."
That's where you come in.
Yeah. He said, "You're welcome to be on it. I'll give you 24 hours to think on it. And if you and your family want to come, I got you a spot." So he gives me his card, and I'm sitting there looking at it like, what is going on? And I'm like, what do you need me to bring? He's like, "I need you to bring in antibiotics,
Your first aid kit, dude.
all this stuff, like the usual." And I'm thinking, okay, well, I mean, it sounds like my sideline kit. All right, let me think. So anyway, I saw him a few times after that, and I told him, I said, "Yeah, man, if you need anything, just call me." So I may have signed up for it. I'm not
Are
sure.
you serious? You totally signed up for it. If you didn't say no, he has your name engraved in a tree outside of it.
You're 100%. You're 100% in.
I still got the card, but
it kind of depends on how things go. That may be better than the catfish fry.
Maybe, but I didn't get. That's what I was going to say. I didn't get invited to that, so I don't know where does this rank?
You're in on this deal way more than you think about.
Yeah, you're way in. If you didn't say no, 100%. Like he's got your name on the door.
I might be on a watch list.
You better carry the extra large band-aids too, by the way.
And just for clarification, everybody, if you're watching the video,
I seen it on the group chat.
Yeah,
Mama
yeah,
in the office.
that's from it.
hilarious.
Now, I forgot the halter was on there. The halter, you can see the halter there.
Yeah.
It had the halter where it was on the leash plus the diaper in the background.
That's hilarious. I love it. Drizzy,
So
bring us home.
yeah, I got a lot of stories that I can't tell.
Well, we
But
all do.
uh, I'll talk about this one. I was in clinic. We ran a Saturday morning clinic, and usually there was only one doctor in the building at that point, right? So I'm the guy that morning, and my standard is to walk up to the room, pull the chart, knock a couple times, walk on in, right? So I did that, and this gentleman was standing over in the corner um, next to the sink, and I'm like, well, that's weird, with his back to me. And so I say, hey, how's it going? And he
Look
kind
at
of
me and
gives
Lee's face.
he kind of gives a couple little hops, to one direction, and I hear a zip, and I'm like, what's going on here? And so he's like, oh, I spilled water on my front. And he sits down, and it was pretty obvious that this gentleman was urinating in the sink in the room. And so, we're always trained to keep that stoic,
Yep.
nothing surprises us. I don't know that I held on to that in that particular visit. Um, and we went ahead. I didn't say anything about it. I didn't challenge him. I just kind of went on with the visit. We got through whatever we were doing. I'm sitting back in my office, and I'm just kind of contemplating it at that point. I'm like, you know, we have plenty of
Bathroom.
working restrooms in this facility. Like, and and just in my own mind, like there are a number of different steps between I have to urinate and I'm gonna pee in the sink, right? So like I'm not sure where the disconnect was there. I mean, maybe I was running really late and he didn't want to miss me,
That's it.
but
That was it.
that was unique. That's a one time in 21 years of practice that I've seen that one.
That is hilarious. You were better than me if you did not ask him if he was not just peeing in your sink, because that probably would have come out of my mouth. I
But
love it.
we'll
I
have to
love
get the other stories out later because there's a lot of them.
Oh
There
yeah.
you go. I'm
there's
sure.
yeah.
I'm sure. All right,
Those are
let's
the
keep
PG. Those are the PG stories, by the way.
exactly, exactly. Well, let's keep going. So back to you, Lee. So in rural medicine, so in a rural medicine practice, your private practice, you are the sole provider a lot of times for a lot of patients, right? So I know you have a huge patient panel and you get there very early, you're often there a little bit late. How do you prevent burnout? Burnout is real. It's real in all types of medicine. It's real in practices where people are not working as much, as long, and maybe even as hard as you are. So, what kind of steps do you take to prevent burnout? It's one of the questions from our students.
All right. So the student question is therapy, is what I said a while ago. Whether, like Ray said, it's building Legos. Drake is cooking. I come home every night and try to relax, and I do a lot of cooking with my wife. We cook together. It's something that we do every day. Something I look forward to. And so therapy is the answer to that question, no matter what it is to you. And so if it's like Ray says, where you don't have to think about anything. For me, I have some goats, and I have some cute little Highland cows that will eat apples and grapes out of your hand. And so it's going out there, it's giving them water, it's taking them an apple and cutting it up and letting them eat it out of my hand. It's getting in a tractor on a Friday afternoon with my brother and the hay baler, and I'm raking hay, and he's baling right behind me, and I know he's behind me. It's things like that. It's whatever your therapy is that brings you down a notch is what prevents burnout. It's doing something else. It's disconnecting from your text machine, because this is, in my mind, the worst thing ever. Social media is terrible. If you believe everything I read on social media, I'm the worst person I know. So disconnecting from that and connecting to something else that is completely mindless in my world like I said, driving my tractor is probably the best therapy I have for me. But the key is therapy, and I'll let the other guys answer, but it is completely whatever that therapy is that is different from whatever you're doing is what it is for me.
Yeah, I agree 100%. Ray and Drake, other ways that you guys have found to kind of prevent burnout in medicine?
Yeah, I think, I've heard Lee say that so many times. You can't put a price on therapy. You start thinking about, because I feel guilty when I do things. If I buy something or if I go somewhere or whatever, I always feel guilty. And I'm sure they have felt that at times. All of you probably have. And, or maybe it's just me. I don't know. But I feel like that you got to put yourself out there and do those things when you have a chance. And I ride a bike. I like that. But I like to just sit on the porch. I like to sit on the porch and just kind of be quiet, and sometimes I'll write. I'll write things that I learned that day from patients or things that somebody might have said, quotes, things like that, and try to find a little bit deeper kind of meaning for what I did that day, as opposed to just checking boxes and, answering calls and messages and everything else. At least I can say I had this encounter that was really important to me that spoke to me today, and I can see where that meaning is in it. So that helps a lot, when you sit down and reflect.
I love that. You say you sit on the porch. You must not have lizards on your porch. You guys all know I'm terrified of lizards, and so there's
As
no
long as
front
there's
porch.
no spiders, I'm okay.
There you go. Good deal.
I like to sit on the porch too, Ray, and watch the goats. The goats are hilarious to me. So you definitely, you boys owe me a trip down here, by the way, and you,
Yes.
Madam,
But
owe me a trip, and we're gonna play with the goats. And
you don't have fainting goats, though.
I do have a fainting goat.
You
Okay.
do?
Yes.
I'm coming to see the fainting goat. I think that's
Yeah.
hilarious. I'm coming to see
Yeah.
the fainting goat. Well, if
No,
the
she's
time
sweet.
I
She's
just
sweet.
really, that's hilarious. I mostly just want to make her fall out, so I'm coming to
It
try.
happens. I do with the lawnmower.
There you go. There you go. Well, when I sit on my porch, and there are times when it's cold and lizards are not out, and I sit out, I end up just like drawing all the kids in the neighborhood to my house. And I'm like, oh no, now everyone knows where I stay. And it's my house is the house when it comes to trick or treating. But if I sit on my porch, it's the house all the other times too. So I don't sit on the front porch as much as I'd like to, but that's a good one, Ray. And reflecting on the day, I think is really important. Drizzy, how do you prevent burnout?
Yeah, I mean, I just kind of, I will say that the parts of my job that burn me out the most are not the patient-related parts. Like they're the EMR and the emails and the finance meetings and the, this, that, and the other. It's not really the interactions with the patients most often. That's kind of where I get re-energized a lot of times is when I'm talking to my patients. But there is a time where you need to unplug, and it certainly is therapeutic. My wife is also medical, and so she kind of understands some of the issues that we face on a daily basis, and that's helpful. We have a pool that we like to swim in. We have a boat. We love to drive around on the lake, and there's some peace and zen in just riding around on the water. So that's probably the best for me. Other than travel, I did mention I love to travel. So if you can get on a cruise ship and turn your phone off for a week, that's pretty dang therapeutic.
Yeah.
So I really do enjoy that as well.
There you go. I love it. All right, so I want all of you to answer this question, and I'm looking at you guys the way you are on my screen. So, Liam, I'll start with you as I have been with these. So, sorry if I'm putting you on the spot to be the first one to
It's
have to
okay.
answer all
It's
these.
okay.
But again, out in rural practice, and everyone on this call has been or is now. But you're there in Otaugaville, and I of course know Otaugaville very well. My family is there. It's home for me. Will you talk to us about the unique challenges that you face with accessing medical resources and specialists that your patients may need? Because as I remember, there are no specialists in Otaugaville. Am I right?
There's no specialist,
You
and
are the specialist.
I certainly don't claim to be a specialist. I claim to be a kind of a jack of all trades and master of none. And so I do a little bit of everything. I do some wound care. I do a lot of psychiatry, child and adult psychiatry. And so you learn to do a lot of stuff on your own. And we do have some stuff in Montgomery. There's some docs in Prattville, or some specialists that come to Prattville. And so, I will say that one good thing that came from COVID is the specialists in around me will answer the phone. And so picking up the phone and actually calling somebody, which is unheard of, I know, has helped. If I need some help, I know some folks that I can call specialist wise that do help me. But do I end up doing a lot of things that maybe Drake and Ray don't do that they have in Tuscaloosa that I don't have yet? Let's just take today. All right, so I had an 88-year-old guy that I dressed a wound with peripheral vascular disease and diabetes. So I dressed his wound, and he's coming back in a week, and he comes every week, and I dress his wound. And that's not unusual. It's wound care every day. I saw preemie 1-month-olds from Children's called me and sent me these preemies, and I take care of them. And they're 1 month today, and they gained weight, and it was great. And what else did I do today? I saw a whole new family of 6, and I did 4 sports physicals, and the mom had a connective tissue disease, and the dad was a type 1 diabetic. And that was all before lunch, and then I went to a Medicaid meeting in Montgomery. I mean, so you do what you have to do, and you utilize the resources you have, but picking up the phone and actually talking to people works. And so that's my advice to any resident student that's listening. And I'll hear what Drake and them have done both. They have specialists in Tuscaloosa, and they've been in Gordo. So I'll be glad to hear what they've got to say about it.
Yeah, tell us about it, guys.
Well, I mean, I think that, the thing that Lee just talked about is what really excites me about family medicine, right? I mean, there are some people that want to look at eyeballs all day long. That would be torture. Like they get paid a lot of money and good for them, but like I love the variety of my specialty. There is orthopedics in room 1, pediatrics in room 2, endocrine in room 3, dermatology in room 4. That's awesome. I love that. So in a way, and the mindset of the rural patient is just a little bit different. So that's one of the things I've noticed. Like when I was when I practiced here in Tuscaloosa, it's like, hey doc, I've got COPD. I've got a lung problem. I need to go see a pulmonologist. And in Gordo, I'd have somebody walk in with crushing substernal chest pain up into their left arm, and into their jaw. And I'm like, look, you need to go see the cardiologist. And they're like, can't you do it? No, I can't, So, there is kind of a different mindset. I did inpatient medicine, outpatient medicine. I worked the ER. I do endoscopy. I've done colonoscopies. You sort of, I've always said that a family doc is like a stem cell doctor. We can become whatever our communities need us to be, right? And so I think that part of it is when you're in a rural area, you kind of have to adjust to that, and you have to figure out what is really critical. What do I need to send? What do I have to send? And what can I take care of here? Like Dr. Carter just talked about, he's taking care of stuff that general surgery would probably be taking care of here in the wound clinic, right? But the different sort of expectations from patients and the abilities of a family medicine physician who is well trained to really take care of 98% of whatever walks in the door, it makes us specialists for rural areas. I mean, that is where we excel.
Absolutely. I agree with that so much. Family medicine is a specialty. Well, you're special docs for sure and can do so much. I think at least once a week I say, well, I've never done this before, but we're going to do it today. And my staff looks at me like I've lost my mind. But it's just what Lee said. I can pick up the phone, call somebody, walk through this with me. I'm out here. This patient says they are not coming to Tuscaloosa. They're not coming to Birmingham. What do I need to do? And our patients have that much trust in us. Now, there are times, we talked about that relationship earlier, where you say, all right, Miss So-and-so, I love you. You know I love you. If I could do this here, I would do it here, but I can't, we can't. We got to figure out a way to get on the road. And then we, work however we can to pull resources together to get those patients where they need to be. But I like that. What'd you say? Stem cell with this
We're stem cell doctors.
Stem cell doctors. I love it. I'm here for it. Ray, what you got?
I mean, I think it's so well said by Lee and Drake and what you just said. I think for me, the key thing than just listening to you all talk is the mindset. You talk about the mindset of the patient, but I also think it's the mindset of the physician. You have to go in as a family doctor knowing that you're capable of doing a lot of things and don't sell yourself short, because that's what happens when we teach here in the residency. There's a quick tendency to say, I want to get this out the door because we have it just down the street. And I always say to them, yeah, but you can do that, and do my philosophy, and that I try to teach them is, you do everything that you possibly can do for someone. If you can do it, don't send it out. The only reason to send it out is if that's something they offer that you can't do. Like I can't do a cath, so I got to send the chest pain out for that. But anything I can do, I want to do it. And then when you do make a referral, your specialist will love you a whole lot more because you're taking the time to do your job and get them the things they need to see. So I think don't sell yourself short. It's a mindset that we need to have.
Absolutely.
Shout out to Dr. John Burnham, who taught us all and taught that in a way is also teaching the next generation, because through us we pass on that same message that you don't refer unless there's a procedure you can't do or a question you can't answer. That is why you refer to somewhere.
Mm-hmm. Absolutely.
Or an ambulance you can't commandeer, because I've done that before too.
Lee Carter is literally, there's a Baptist church across the street from him, and every time I drive by, I think about him having a helicopter, a med helicopter, drop right in front of his clinic to pick a patient up. Only in a talk show, only Lee Carter is that happen.
Have you driven an ambulance?
Probably so.
I have not driven an ambulance.
Yes, he has.
Here's what
can't talk
I did.
about it on the podcast.
So I had an ambulance at the office dropping off or bringing me a patient that could not walk. And so I had a patient having an active MI that walked in, crushing substernal chest pain, get an EKG real quick. And they have, tombstones, had a previous MI and they got tombstones. And I was like, hey, y'all driving this lady to Montgomery now. And we're not on call. We just drove this other person. I don't give a damn what you're doing. You're fixing to drive this lady to Montgomery. I had her chew up an aspirin. I got oxygen on her. We put an IV in, everything we can do at the office. And so they wanted to argue with me. And I said, call whoever.
And Lee said, either you can drive the ambulance or I can drive the ambulance.
I'm about to drive her too. I'm going to turn the damn lights on and we're going home. This is, I'll show you the EKG. It's right here. We weren't playing. This lady's having an MI right now. I can't help she walked into my office. They do that all the time. They walk in, you walk out. I was coming around from getting coffee and breakfast one morning, and some guy's trying to talk to me that I've known for 10 years, and he can't talk to me. He walked in the clinic, but he knows who I am. He can't get the words out of his mouth, having a stroke. So I just helped him walk to the back because he can't walk straight either, and call the ambulance. When I got the nurses to call the ambulance while we were walking to the back because he's having a stroke. But that's rural medicine. Y'all guys have some stories like that. Y'all know what I'm talking about. It's just real.
It is.
Yeah, it's just what happens. But yeah, I commandeered an ambulance that day. I convinced whoever was on the phone. They were driving. Lights, sirens. I said, it's me or them. It was them that day, not me.
I love it.
But a month ago, my office staff, we had a lady come in with a broken humerus, obviously broken, dislocated humerus, fell in her bathroom, and she was tough enough. She drove to my office, the 2.5, 3 miles that she lived from my office, with a fractured dislocation of her humerus. And I stopped clinic, and the ambulance was 40 minutes out. And so one of my nurses, while I still was in clinic, one of my nurses drove the lady to the emergency room. We called and told them they were coming.
Yep. That's real medicine.
You do what you got to do.
Yeah. I was going to ask you guys to give me a one-liner to end this about rural medicine. Lee, is that going to be yours? You do what you got to do?
You do what you got to do.
There you go. I'll take it. I'll give you guys 2 seconds to think about it.
That's hard.
Yeah,
And
one-liner.
No, that's my one line. No, I'm just-
I'll let you off the hook a little bit. Either give me a one-liner or tell me what you wish listeners to this episode knew about rural healthcare.
I mean,
Priceless. It's priceless.
it is. I mean, you're taking care of people that are friends and family that become friends, and you see them not just in the office, you see them at the grocery store, you see them at the ball field. I mean, you see them at church. You're a true part of the community and an integral part of the community. If you're looking to make a difference, rural medicine's the way to go.
Absolutely. Right.
Well, y'all have heard me say this over and over again to you and Lee, especially. I don't feel like I'm a real doctor. I feel like y'all are, and
I call you.
y'all are out
All of
there.
you guys.
No, all
Well,
of you are real doctors.
we need people willing to step out on the edge and to do what you've done, Brittney, and do what you're doing, Lee. And we did it for a while, and I think we need more people that are willing to go out there and to live it and work it. I mean, the way you are, and know that you're doing it for a higher purpose. And to pour everything into it, and that's the only way that we're going to be able to take care of everybody as we move forward. Because things are hard. Medicine is not easy, but it's worth it when you look at the impact you have and the relationships you build.
Absolutely. Absolutely. Well, my one-liner would be that there's never a dull day. There is never a dull day in rural medicine, and there's never even a dull day in family medicine, right? Because the beauty of family medicine, like we've said, is that there's so many things that we can do, that there's the possibility for every room to be something different. And so whether you are practicing rural medicine or not, practicing family medicine is a gift, and it is a gift that allows us to be able to not only have that gift for ourselves, but to be able to be a gift and to be a blessing to our patients, to our staff, and to all of those who come along. And so for those who are listening to this, whether you are an attending, a resident, a medical student, or even if you're not in healthcare or medicine at all, if you somehow found us and are listening to us, we hope that you have enjoyed this. I've enjoyed you guys, Lee, Ray, Drake. It's been great having you guys here. We made a joke earlier that we kept this as PG as we could, and I am so proud of you guys. There were no F-bombs dropped. I am proud. No one has said what's in the cup that they're drinking out of. And so it has been fun times. I love you guys so much. As Ray sips out of his cup there, we'll say it's coffee. Hot tea is exactly what
Mine
it
is
is.
unfortunately empty.
There you go, which is a whole other story. So maybe there will not be a part two of this episode, but we hope you guys have enjoyed listening. And to you guys, thank you for being here with me, and thanks for everything you do. I lean on you guys so much in my own practice, and have since I was a pre-med student, med student, resident. And so I love you guys as though you were my older brothers, and it's been fun chatting with y'all today.
Thanks, Brittney.
Enjoy it. Thanks, Brittney.
Yeah, thanks, y'all.